Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology. Dr. William Barlow Jr. is a comprehensive ophthalmologist at the Moran Eye Center with expertise in cataract and refractive surgery. Dr. Barlow completed medical school at the Medical College of Wisconsin and completed a residency in ophthalmology at the Moran Eye Center at the University of Utah. Dr. Barlow is a team ophthalmologist for the Utah Jazz. All right, Dr. Barlow, welcome to the show.
Thanks for having me.
We'd love to hear how you first got involved with sports ophthalmology.
So getting involved in sports ophthalmology was sort of fortuitous, just working at the University of Utah. The Utah Jazz organization updated their contract in terms of who they wanted to provide the healthcare coverage, and they approached the university about that. And so a team of providers or physicians, surgeons, different specialty personnel from the university were recruited to do that. I was fortunate enough to be one of the people selected to be involved, myself and Dr. Brian Zog in our department as well. So somewhat just fortuitous, dumb luck, if you will, but definitely something I've always been interested in sports. And so the opportunity to jump in and be involved in some way was a no-brainer for me.
Is that something that you kind of applied for? They're like, hey, we have this new contract coming up and who's interested, or how did that work out?
So it was sort of a few of us that were actually interested presenting to the department leadership and the university leadership about why we wanted to be involved, and then they made a selection. I think originally they were hoping to rotate through to get more people involved, but Utah Jazz really wanted to maintain a relationship with the same people year over year. And so that's why it's been sustained, the same individuals working with them, which is good for me. I get to keep doing it year over year.
Yeah, I'm excited to hear more about kind of that model of care. First off, what do you feel, what's your take on the subfield of sports ophthalmology?
Honestly, I don't know much about it if there are people who are actually trying to subspecialize in that area. Certainly I know there are people who are looking at different things in terms of visual training, different, sort of aspects of how do we improve performance. I don't know that there's any good evidence to support the idea that these things really work, but I do know people are trying them, doing them, and utilizing them. Some of the organizations in the NBA have individuals that I know kind of push those ideas, or at the very least offer those options to the players. I'm not aware of any that are actively doing it and promoting success with it, but yeah, some interesting ideas in terms of trying to enhance sports performance, specific skill set performance, in basketball, baseball, other sports. So,
got it. So suppose I happen to shadow you and I experienced every sports-related responsibility that you have. What would I see? How would that change on season versus off season? What would that look like?
So on season, we're primarily responsible for covering injuries or issues that arise during the games. So we'll show up about an hour and a half early to the game, check in with the medical staff, training staff of the organization that's hosting the game, but we do cover for both the home and away teams, just primarily checking in to see if there are any issues that need to be addressed. We will not only be involved in terms of managing any in-game or pre or post game concerns, but we'll also be involved in managing people within the organization, people that are peripherally connected to the organization. So, occasionally you'll get somebody, they want to curbside consult you on some issue that's going on while you're at the arena. In terms of getting ready for the season, right before that, obviously they'll have training camp, go through a bunch of different testing that's required by the league. That'll include some rudimentary eye checkup, exam or eye exam, things that we'll check in with players. It's sounds a lot more glamorous than it probably is in reality most of the time. These are young, healthy individuals, and so from an eye perspective, typically they're seeing really well. Maybe they've got a little refractive error. They need contacts glasses. They're asking about refractive surgery, LASIK, PRK. Would they be a candidate for it? What would be better for them? In their career pursuit. That's where it might get a little interesting from my perspective is the refractive side. But in terms of injuries, fortunately, we don't see a whole lot in that regard. We've had a few injuries in game or during the season, a couple of corneal abrasions, a couple of facial lacerations that were relatively superficial, that were easy to close. I think we had one player that had a commotio, so retina injury, fortunately recovered. So we haven't seen any of those, bigger injuries like you see with Joel Embiid with orbital fracture issues that he dealt with, historical issues from players in the past, retinal detachment, different things like that. But for the most part, in spite of the fact these very big freak athletes, I call them freaks of the freaks, because these guys are just off the charts in terms of their measurables. Fortunately, don't end up having too many issues that we have to deal with.
So I think it would be great if you could touch on that conversation that you mentioned with athletes that are interested in LASIK or PRK. How does that conversation normally go, and what's kind of the majority of the decisions that athletes are making?
So obviously the biggest driver in the decision, number one, they've got a stable refractive error, corrected well with their contacts, but they'd love to get away from using those. Obviously, timing, you're probably looking at an off-season decision. With the type of work that they do, being on the court, there is that theoretical risk of getting struck in the eye. And so you do worry about the theoretical risk of a flap being injured or dislodged. And so LASIK sometimes may not be considered the best option. However, with the advent of femtosecond laser, LASIK flap creation, those flaps are stronger than your microkeratome-based flaps. And so I think that the LASIK option is a more viable option now, relative to what it would have been, if we had this conversation 10 years or longer ago. PRK obviously eliminates that flap concern, but then there's that recovery components where, they've got some downtime. They're maybe in their off season, they want to go somewhere warm, sunny, and that's not necessarily ideal for recovery from PRK. And then obviously they've got their off-season workouts, so they want to add a couple of moves to their repertoire, work on their game in some way, shape, or form. Waiting for their vision to recover to where they're comfortable with that, so they may not be as excited about that. So those are kind of the conversations we have. Pros and cons of LASIK and PRK. I'm aware of a few players that have had LASIK. One player that Dr. Zog did PRK for here this past off season. So we try to help them make a decision that they're comfortable with in terms of risks and benefits. But I think both are viable options for players these days.
So, talking a little bit more about the models of care in delivery to athletes, could you speak about the different care models that are given to professional athletes?
Sure. So, different organizations, contract with individual care, different specialties based on what they feel like they need. So the Utah Jazz chose to go with the University of Utah with this most recent contract. In the past, they've had people from the private community that have provided that care. It's important to note that players oftentimes have their own, sort of healthcare personnel. Some, that have, really good healthcare training. Others that have very rudimentary healthcare training and have the ear of the player, and so can be a bit difficult to deal with at times in terms of trying to get the best care available to that individual player. As you know, if you just pay attention to players and when they have injuries and who they go to, oftentimes we're just connecting them with someone that's considered the preeminent expert in the particular field, particularly with sports-related injuries. Travis Mack, who's our orthopedic consultant on the team. I think most of the players that end up with issues end up going to somebody outside of our system for the care that they receive. So there's certainly a dynamic for us of communicating and working with players' own private healthcare consultants, physicians, surgeons, and that can sometimes be a bit of a difficult issue at times if the communication's not great or if there's some misunderstanding or different viewpoints. You'll see that from time to time, and certainly you see that play out in the real world. An example of that may be Cam Rising, quarterback for the University of Utah this past season. I'm not sure if the misunderstanding between the coaching staff, our medical staff, his surgeon, and some of the friction that occurred mid-season. Fortunately, it looks like it's been smoothed over, but those are the issues that we deal with as well, with our experience.
Yeah, that's really interesting. That's something that I hadn't considered before. Uh, like a professional athlete having their own doctor, their own friends. I'm sure they have extensive networks and people that want to help them too. And so maybe your role is more just connecting them uh, to that world renowned specialist because that's who they want to see, right?
Yeah, absolutely. And players talk to each other. I mean, it's a small community. They all know each other. So when something happens, the agents, players talk to each other, agents talk to each other. And so, yeah, they will often get plugged in that way. And so it's our job to interface with those individuals to make sure that we're providing, continuity of care in terms of what's needed to rehabilitate and get that player back up and ready to go in terms of playing and getting back out on the court or on the field, whatever the issue is.
So for the NBA, there's quite a few number of games. Do you go to all those games or do you split that up with your
So,
colleague? How does that?
yeah, Dr. Zog and I split that up, and that I describe it as it gives you enough to really feel like you're a part of it and be actively involved in the day to day, but at the same time, it doesn't feel too much like a job. If you have to show up to every game, it might start to feel like a job to some degree. And I guess it is a job, but I want to enjoy it, and so Brian and I, we'll split the games, and I sort of say it leaves you wanting just a little bit more, which is nice. That half season split up there, and if there are games that I want to go to, sometimes I'll try and finagle my way into some extra tickets to go to go to the game as well. But yeah, we split it up 50-50.
Yeah, does that come with like a plus one, or you can maybe bring some of your family along too, or what does that look like?
Yeah, I mean, each organization is different. For us, the sports staff, they're down right behind the bench, and so it's just them. We have a plus one, so we're up on row 14, the section right behind the bench. But still great seats, great view. But we get that extra ticket. You get access to some of their amenities there on site. So the Toyota Club, so food and beverages and snacks, different things that you have access to. So it's a nice setup where for the most part I'm just a fan enjoying the game, but I have some basic responsibilities that I check in for. But most of the time, again, these guys fortunately don't have specific issues that we have to address, and so I'm just there enjoying the game and just happen to get a chance to go down and maybe interact with people just a little bit before and after.
So for the institution that I'm at right now, UT Health Science Center at San Antonio, we just recently had a contract made where we're delivering care to the Spurs, San Antonio Spurs. And right now, I know the ophthalmology department is kind of rotating between the different residents and fellows, them going. Um, Is that something, do trainees come with you? Or I know you mentioned maybe you just keep it as the two ophthalmologists to maintain that relationship, that consistent relationship with the team.
Yeah, so we have the two that myself and Brian Zog that are directly involved with the team. I know there have been a few times where I've taken colleagues. Jeff Petty is sort of an emergency backup for us as well. Residents don't come very often. Occasionally, we might invite a resident or a fellow to come along, but we don't have them generally actively involved. Although I haven't had any residents express a ton of interest, saying, "Hey, I'm interested in sports ophthalmology." If we did, we'd probably find ways to get them there, more consistently to see that and be involved in it.
So specifically for the sport of basketball, basketball has been cited as a sport causing the majority of eye injuries, depending on the age, depending on the study that you're looking at. What is unique to basketball? What's your theory on why basketball is so common for eye injuries to the point of a professional team having a team ophthalmologist there at every game?
Obviously there's a lot going on, on the court. It's pretty rapid activity in terms of going up and down the court frequently. There's a lot of close interaction, particularly in the paint between players without really any protective gear. Football, they've got helmets and visors and different things that really prevent that sort of issue for the most part. Baseball is just not a very active sport, honestly, unless they get a ball to the face. So basketball, you've got elbows swinging, hands swiping. They might swipe up or down at the ball. I think if they swipe down, you're much less likely to have a direct eye injury because the upper lid will sort of close with that action. And when I've seen some corneal injuries, it's usually it looks like somebody swiped up towards the ball and they've missed it and caught the face and up into the eye. Obviously, I think the bigger injuries, like Joel Embiid's orbital fracture, I mean, it's sort of like an elbow or something more significant that can get into that space around the orbit to create that problem. But I think it's just that physical nature of the game, that close action, the speed of the action, so the number of opportunities for those types of injuries to occur. I think that's the main reason that you see more eye injuries. It's a relatively small space to plug those people into, as opposed to a soccer field or et cetera, like things like that.
So for eye protection in NBA, there's some people I know. Amari Sotomayor, after he had um, eye injuries, started wearing eye protection. What's your experience in working with these athletes and discussing eye protection?
So, specifically the player that I mentioned that had the commotio injury, we tried to convince him that eye protection would be ideal for him. Maybe, hey, Kareem Abdul-Jabbar wore nice goggles, and those worked really well for him. Maybe this would work for you. And that player had no desire for that to wear those. So it really is up to the individual player ultimately. You can't really force them to do anything. And again, we talked to a few players about it, but there are very few that are willing to do that. I think Scoot Henderson, a rookie on the Portland Trailblazers, I noticed he wears goggles. So I don't know about his history, whether he's had an injury in the past that sort of motivated him to do that. But at any rate, that definitely is something we talk about. But I don't find too many players taking us up on really diving in and exploring those options.
So in that instance, with a retina injury, is there kind of a go-to retina sports person that you talk to, or at that point, is it just you speak with whoever the kind of expert is for that field, then you just go directly to them?
So, within our system, we've got a number of retinal specialists. They're all really quite good and capable of handling, questions on that. So we typically will just involve somebody that we, have easy access to in our department, or there's always a retina specialist on call. We might, if it was a more urgent issue, we'd engage the retina attending and the retina fellow on call. Fortunately, this one was more of a issue where it could be addressed just with a clinic visit and follow up based on that. And I know that specific retina attending did try to really push for eye protection, particularly as the player was ramping up to get back on the court. But yeah, the player was adamant he was not going to wear those goggles. So fortunately, nothing happened. He recovered just fine, no issues, and didn't get hit in the face or the eye again that season or beyond.
So it seems like as a sports team physician, you have closer contact with these athletes, um, maybe a closer relationship, get to know them a little bit more. It seems like it's a very unique patient population, unique aspects to be aware of. For example, having their own personal doctor on the side, having to navigate that. Um, I'm thinking about like if I worked with kind of a different patient population, let's say rural medicine, there's certain things that I need to know about that patient in order to. Is there anything specific to working with the professional athlete that you would say is important to keep in mind?
You know, I don't know that there's necessarily anything unique to this professional athlete. You find out that they're young males that have very similar interests to young males in general, and maybe some
Mm-hmm.
that they're still young and inexperienced. So maybe they interact with you differently than what we see in ophthalmology, which is obviously a lot of older patients. They've got handlers and people that are involved. We haven't had, again, a lot of injuries that we've had to address or deal with. So for the most part, they've entrusted us to take care of those issues. And they've, again, fortunately been pretty minor issues that were relatively straightforward to deal with. So players have sort of put their trust in us on that, as opposed to, again, some of these sports injuries, orthopedic injuries that have led to players seeking out specialty care throughout the country. We really haven't had to deal with that, but yeah, more often than not, these are young guys that are just act like a young 20-something would. They've got their cell phones. Sometimes their face is buried in their cell phone as you're trying to interact with them, getting them to get off their socials or whatever it is that they're interested in. But yeah, they're pretty down to earth young people for the most part. Some of them, as they gain notoriety and popularity, maybe create some more barriers, but haven't really had to deal with anybody that is at the peak of popularity where we've had to try and break that down. I imagine that might be a challenge, but thus far haven't had to broach that issue.
Have you had much experience working with collegiate athletes or maybe high school athletes? And what does that look like compared to your experience working with a professional team?
So we'll interact a little bit with some of the University of Utah collegiate athletes. For the most part, it's providing basic eye care. So I'm helping to arrange that aspect of care, whether it's with me or with somebody that's in our department that's interested in being involved in that. Yeah, I mean, you do get to spend a little bit of time talking to them about their visual needs and what they're interested in terms of correction. They're all, for the most part, again, young people, and so from an eye perspective, I think the exam and other aspects are pretty routine. But certainly talking to people if they're interested. I haven't had those types of conversations with collegiate athletes, but if somebody's interested in different vision training programs, that might be interesting to see, what's out there and what might be applicable to them.
So for the resident or early career ophthalmologist or medical student, what advice would you have for them if they say, "Hey, I wanna be involved with sports ophthalmology. I wanna be where you are." What kind of things would you say to them?
I think if you're interested in it, try and find a program that has a connection that you can get involved with, whether it's directly like ours or somebody in a department that maybe knows the individual that provides the care for a local sports team, and find out what's their involvement, what do they do, and see if you can connect with them. Um, I think most NBA teams have, probably all of them have some sort of eye care coverage. I think most of them now have it in-house, so they're in the arena during the games. Dental, sports, eye coverage. I don't know about other sports. I mean, that would be interesting to see. I don't know if baseball teams or NFL football teams do. I know a college standpoint. No, our football program doesn't have anybody on site necessarily to cover eye injuries because they're just not very common on the football field. But yeah, that's what I would suggest. Obviously, you're still going to focus on the things that everybody would tell you to focus on in terms of doing well in school and doing well in your residency training. But yeah, I don't think there's anything wrong if you're interested in it and sort of asking programs about it. Say, hey, I'm interested in this. Tell me about whether your program's involved, or do you know somebody in the community that's involved, and how I could get connected with that if I ended up matching or coming to your program.
So some people take the route of here's work, here's my life or my hobbies that I like to enjoy, and I don't want to mix them. What has your experience been like, maybe taking this hobby of sports and maybe mixing it a little bit with your professional life?
I mean, I enjoy sports obviously, and so and I enjoy the job that I do. So it was an easy fit or transition in terms of bringing those together. I don't, at least in my own personal, opinion or viewpoint, I didn't have any problem with being involved if my expertise was needed, but being able to be involved just as a fan as well. Can't think of too many other things that have hobby ways that meld the ophthalmology side. As a physician, I guess if somebody out on the golf course dropped and needed CPR or something, the people screaming, "Is there a doctor?" And I'd be looking around to see where's the real doctor who's going to handle this. Oh wait, yeah, that's me. Yeah, but I enjoy both. So it's kind of fun to cross those over and be a part of it.
Last question. Do you have a favorite sports team and a favorite sport?
Boy, that's a tough question. I went to medical school in Wisconsin, so I mean, you can't spend time in Wisconsin and not become a Green Bay Packers fan. It would be blasphemy if you didn't. So, yeah, I enjoy football. So the Green Bay Packers are my favorite NFL team. Obviously, the Utah Jazz, my favorite NBA team. Baseball. I don't watch a lot of baseball. I grew up a San Francisco Giants fan. As a young kid playing baseball, and I'm left-handed, so I was always interested in lefties in baseball. So Will Clark was a player that I followed from back in the 80s and 90s when I was growing up. I enjoy golf as well. It's a fun sport that you can keep playing as you get older. Not quite as physically taxing as basketball or other things. So. Yeah, those are my favorite teams. Collegiately, obviously, University of Utah. Yeah, we have season tickets. Go to all the football games. It's a lot of fun.
That's awesome. Thank you for your time,
You're
Dr.
welcome.
Barlow. Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.